All right. We are here today to speak to our wonderful patient who's just about to have surgery for some lesions on her toes. Before I talk about the surgery, I want to talk about these lesions. Is that all right? Yeah?
Yes.
How long have you had them for?
Years. Maybe about 10 years.
10 years. Now, how did you get them? Was it after wearing certain shoes?
Yes.
What kind of shoes were they?
High-heeled stiletto shoes, pointy shoes.
Pointy shoes.
Yeah, some round, but whatever it is, yeah.
So when you first got these irritations on your skin, did you go and see anybody, or did you just go to the pharmacist, or what did you do?
So I just started self-treating. So I thought there were corns, so I just went to the self-care aisle and got like corn patches and salicylic acid to kind of get rid of the what I believe was thick skin growing on top of the toes.
See, unfortunately, a lot of people like you, they think these lesions are corns, yeah? They go to the pharmacy or the local supermarket and go to the aisle that has got all these corn plasters on, and they put a corn plaster on top of these lesions. Now, when you put salicylic acid on Afro-Caribbean or South Asian skin like mine, you will cause a burn, so you cause a skin burn. Did you do that a few times or just once?
I did it a few times, yeah. I mean, I gave up because I didn't feel like anything was working, so it went down to filing, which was painful and quite messy, and just didn't get any joy whatsoever. So I started covering it up with makeup.
Okay.
It was just absolutely a mess.
So did you visit any health professionals about this?
No.
No?
I didn't. I think I got some advice from a podiatrist years ago.
Yeah.
And they just basically said that they confirmed it was a corn and that they could remove it. But then I got advice from someone else and said that it wasn't.
Okay.
I was just getting quite conflicting advice.
So most podiatrists, unfortunately, don't take these very seriously. And the reason why they don't is because, as you know, these lesions don't cause you any pain. So what people often think is if a lesion doesn't cause any pain, that it's not causing any problems. But did it affect your self-confidence when you wore shoes?
Absolutely, exactly that. So you go to a healthcare professional, they basically just, laugh it off or say, you're worrying about nothing. Basically say it's cosmetic. Yeah. There's a lot more in the world to worry about. So you feel a bit like mixed. You do feel, well, thank goodness it isn't anything severe. But then at the same time, when you want to wear more comfortable shoes, more open toe shoes, you can't. So you're in a catch-22, you go back to wearing uncomfortable shoes, and then I get more lesions. I started off with one, and every year I'm seeming to get more and more. So,
it can. So I know it can really affect your self-confidence, which is what happened to you. You will stop wearing certain shoes. I know ladies that have stopped going on holiday to warm countries. I know ladies that have never shown their feet to their partners. So even though it doesn't cause pain as such, it can really affect the quality of your life, which it has to do with, We've had a couple of chats now, or a couple of consultations, and I went through various options with you. So I went through, you can have bone surgery for this, and I talked to you about the pros and cons about having bone surgery, and we talked about the injection option, and we talked about the surgical option, which was the skin surgery option. Out of interest, what made you think, or what made you decide on choosing the skin surgery option?
So you did go through with it, and it still, resonates, like what you said about the surgery, the bone surgery. But that was for me. When you told me about the cons, I'm not really wanting to try to
cut your bone.
Yeah, I mean, the informed decision here is it is cosmetic, and correct, and for my self-esteem, I would love to correct it, but I'm not willing to put my health at risk and create problems with walking or anything for this. So the idea to kind of it is more like a patchwork, I guess, over the issue. and then prevention. So I feel that probably would be the best thing. Get rid of what I've got and then just
try and prevent it from happening.
Exactly.
So with the skin surgery, like you've met my wonderful team today, so it's not just me on my own, and I have some very good colleagues that help me with the skin surgery. But with the skin surgery, when we remove these and we give you sutures, once this heals, it will be a very small line, thin line only. But prevention is essential. So we will talk about footwear. We will talk about exercises that we can do to prevent you from clawing your toes, and props that you can put underneath your toes and things you can put on top of your toes, because what we don't want is for this to be a regular occurrence, that you carry on having skin surgery every couple of years. So we've done a lot of procedures now. We've done over 124, 125, that's quite a lot. So we've had patients from all around the world. We generally get a really good outcome from patients. We've had very few complications. However, I'm going to go through all of the aftercare with you afterwards. Are you excited?
I am. This is like a new lease of life. I'm so excited. I can't believe it. I could, finally wear like open toe shoes. I can't wait.
Wonderful. Okay, let's start all the checks, and then let's start the surgery. Thank you.
Yeah. Please tell me that I can't, that I won't, that I fail, that I'll never make it out, yeah. Please tell me all the bad, never good, fill my head full of every single doubt, yeah. Please say any negative thoughts, I pop off when I hear people say I cannot. I get off to the thought of proving everyone wrong, I won't stop to the top, so you better back off and get lost. I'ma stay loud, stay proud, never running out, never heading south. I'll be spreading out, call it word of mouth, can't put me down, I'll be getting loud. You can have your doubts, not what I'm about, have your cloud, it be raining now. I keep making sound, go another round, I'm legend bound, can't stop me now.
You don't wanna fuck with me, a slow burn like a disease. Just tell me that I can and I'll show you things that you couldn't believe. Just tell me that I can. Just tell me that I can. Just tell me that I can. Just tell me that I can.
Cause I just wanna hear it out your mouth, yeah. Give me fuel, it's a tool that I use to go ahead and run my mouth, yeah. I take shots, I take loss, I make shots, I miss lots. That's how you get big box, you get yachts, you swing lots and pop off a big shot. I ain't done chasing, got big dreams, bigger things, impatient. Who's at the top think they need replacement? Who's at the top think I'm gonna erase it? Face it, I don't give up quick, I don't give up shit, I won't give up this. Cause I know that I want it, know that I'm on it, I'll make it, I promise.
You don't wanna fuck with me, a slow burn like a disease. Just tell me that I can and I'll show you things that you couldn't believe. Just tell me that I can. Just tell me that I can. Just tell me that I can. Just tell me that I can.
I got no love for the fakeness. If you wanna play tough and wanna hate instinctive and so passionate. Every word I move so descriptive like an adjective. I got a vendetta against people who patented being negative when you should be getting after it. I got facts over tracks, this and that, spitting slow, spitting fast. I could roast, I could gas, think I'm okay at last, but I don't know if that can erase all the past and the pettiness. A reflection of the emptiness, hilarious. You think you're worth my time, you're delirious, mysterious, because you hide behind a fake exterior. Inferior, you know I'll always be a bit superior. Get off of me, this ain't no humble brag. I want you to hear words, you can say them back. I want you to feel free from the chains that last, and to believe in what you got, it was built to last, yeah.
Now that I've been put through, I never got anyone's help. I had to do it all myself.
I don't ever slow up, no I don't take sh**. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up and make a statement. I don't ever slow up, no I don't take sh**. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up and make a statement.
Gonna learn the consequence of being incompetent. Mental health is confidence, dreams and some honestness. I'm not here to save the day, that's for you to take away. I could play a million mind games, but instead I say something not illogical, something that is topical. Rub it on and watch it go, make yourself unstoppable. Dreams are irresponsible, but they're always possible. If you just believe, you could be so remarkable.
Thoughts in my head, a collage and they spread. I'll be great one day, going off of my meds. No, I'm not giving up, no, I'm not giving in. I will make it to the top, taking off in the wind. I gotta make it, I'm saving every day to taste it. I'm patient, but my mind, it can hardly take it. I'm chasing a dream that I've had for several ages. A vacant, modern kingdom for the taking.
Now that I've been put through, I never got anyone's help. I had to do it all myself.
I don't ever slow up, no I don't take sh**. I got no love for the fakeness. If you wanna play tough and wanna hate this, I'll always show up and make a statement. I don't ever...
You've had your surgery. How was it, apart from you just lying there with your headphones on?
It was really relaxing. Didn't feel a thing. Absolutely. Perfect.
Did you feel the anaesthetic injections?
At the beginning, yes. I did feel, but it wasn't that. It wasn't.
I use a cold spray, don't I? So I've gone through the entire aftercare with you, so you've understood everything?
I do.
Good. So the toes are done. Toes are done. She's got little splints underneath to keep the toes straight. And I am looking forward to seeing the results.